Mr. Johns for 2.5 minutes, please.
My colleague just talked about mental health, and you cited the commitment of $25 billion over 10 years, $2.5 billion years, but you didn't talk about the fact that it's over 4 priority areas. So I did the math, and you're falling short on your commitment of $4.5 billion over 5 years to deliver mental health by $1.375 billion. I've talked to you about this, about creating a direct fund to make up for that gap, given that we're in a crisis when it comes to mental health and for post-COVID recovery. Are you considering looking at what I've talked to you about and delivering something in this budget?
As I've mentioned previously, we've made a commitment with provinces and territories of $200 billion over 10 years, of which mental health and substance use is one of the key pillar priorities. We know that as I said in my opening remarks, mental health services and substance use services really need to be part of universal healthcare systems in each of their jurisdictions. This is what we're moving towards in these bilateral agreements. We don't have all of them in place yet. In weighing out considerations of additional funding, we are encouraged by what we've seen so far in the proposals of the agreements that we've seen, of the investments that provinces and territories are making. And as I mentioned, also meeting quarterly with my counterparts, we are pushing them to make those commitments with the budgets that they're receiving.
We're hoping that you're going to increase it.